Welcome to the latest edition of Endocrinology Updates, covering breakthroughs in the past 2 weeks. Brought to you by LucidQuest. In recent research, a study from Hong Kong examined the effects of parathyroidectomy on diabetes risk in primary hyperparathyroidism, or PHPT. The study, which involved newly diagnosed PHPT patients, found that surgery was associated with a lower risk of developing diabetes compared to non-surgical care over a median follow-up of 2.8 years. These findings may inform clinical practice and payer discussions, though the interpretation depends on study design and how confounding factors were controlled. A second report from Biomea Fusion discusses the results of a mid-stage study on icovamenib, a menin inhibitor, in type 2 diabetes. This year-long study, which included a subgroup of GLP-1 non-responders, demonstrated sustained reductions in hemoglobin A1c even after discontinuation of therapy. Notably, the effects were particularly strong in insulin-deficient and GLP-1 non-responders, although full endpoint data is still pending. This new treatment could influence the choices of prescribers and payers depending on the final data. HealthTap has partnered with LillyDirect to integrate virtual diabetes care into their platform. This collaboration enables HealthTap primary care clinicians to provide medication management, lab reviews, and preventive care remotely. This virtual integration may streamline patient initiation and adherence, providing more efficient care, especially in managing type 2 diabetes remotely. In a breakthrough for gestational diabetes mellitus, or GDM, a recent study identified GPX3 as a key biomarker for placental ferroptosis in GDM. This bioinformatics and clinical sample validation study offers new insights into the pathophysiology of GDM and could have significant implications for clinical practice. Further studies are needed to confirm these findings and determine their potential for improving patient management. PANTHERx Rare, a specialty pharmacy, has been selected by Chiesi to distribute MYCAPSSA, an oral form of octreotide used in the maintenance treatment of acromegaly. This exclusive partnership aims to improve access and patient support for those requiring long-term acromegaly treatment. MYCAPSSA is designed to offer greater convenience and flexibility for patients who have previously responded to injectable therapies. MannKind's Afrezza, an inhalable insulin, has had its supplemental biologics license application accepted by the FDA for pediatric use. The submission, supported by the Phase 3 INHALE-1 study, targets children aged 4 to 17. The FDA has set a target action date of May 29, 2026, which could lead to broader pediatric usage of Afrezza, pending further data and regulatory review. In other diabetes news, Eli Lilly has reported positive results for orforglipron, an oral GLP-1 receptor agonist, in 2 Phase 3 studies. The drug demonstrated significant reductions in A1c and weight loss when compared to both dapagliflozin and placebo over a 40-week period. Lilly plans to release more detailed secondary outcome data in future reports, which may influence clinical practice and prescriber choices in type 2 diabetes treatment. Lastly, Biocon Biologics and Civica have launched a new private label insulin glargine. In the US, this affordable insulin is designed to improve access to diabetes care for patients across the country, with Civica handling the commercialization and Biocon supplying the product. This move could introduce new competition in the US insulin market, potentially impacting pricing and formulary access. Stay ahead in endocrinology research. Like, share, and subscribe for our updates. Visit lqventures.com or email us at info@lqventures.com for expert healthcare consulting. See you next